Aleene Kann, who simply picked up her dog Zoe to help her get into the car, but Zoe jumped wildly in her arms and Aleene heard a pop in her back. At first, Aleene thought she was okay, but later that night, everything changed.
Went in the walk-in closet that night to take off my jeans. I went to pull those down, and when I leaned over to pull them down, the most excruciating pain hit me. I had to crawl out, and this leg was not moving. This leg was dead. I had nothing here, no feeling whatsoever. I couldn't pick up my foot.
The first thing the next morning, Aleene went to her neighborhood chiropractor, whom she had known for years.
He said, I can't do anything. He said, my best recommendation at this moment is Southeastern Spine Institute.
At the Southeastern Spine Institute, they get patients in as quickly as possible because they know when you're in pain and suffering muscle weakness or numbing, it's very important to get evaluated as soon as possible before things might get worse.
We do pride ourselves in getting patients in as quick as possible, getting them expedited, being seen, evaluated, getting the appropriate imaging done in an expedited manner, and coming up with a plan based on that imaging.
And a part of coming up with a plan is getting accurate imaging from Southeastern Spine's new state-of-the-art MRI. Angie has more.
With new wide-bore MRI, Southeastern Spine can now provide more patient comfort and precise diagnostics for your specific issue. These modern MRIs allow the patient to go into the unit feet first, helping those who might feel claustrophobic. And with the latest technology in reading and evaluating the imaging, doctors can have a more accurate diagnosis when they sit down with the patient to create the best medical plan for fixing their specific problem.
He had already had the MRI, the X-ray, and the information. And when he walked in the room, basically all that I remember, because I was so uncomfortable, was, you have to have surgery, and the sooner the better.
And those patients that are having numbness and tingling, weakness, that oftentimes is related to pressure on the nerves, and that needs to be addressed so that they do not end up with permanent nerve damage.
While the vast majority of Southeastern Spine's patients never need surgery and can be treated non-surgically, in Aleene's case, surgery was the best course of action to get her back into her active life, and she couldn't have been in better hands.
In terms of a surgical reason to come to Southeastern Spine, we have the ability to do everything, and in a way where you have multiple providers all working together in the operating room.
There are many hands helping out in the operating room to help expedite the care and make it safer for the patients.
I was just so grateful that he said, I can fix this and you're going to be fine. To be able to go from where I was a year ago today, I know that I couldn't have done that without his help and expertise.
Often these modern surgeries allow people to get back to doing the same things that they were doing before they started having back and leg problems. And in Aleene's case, she was able to get back to training for the Cooper River Bridge Run. Although the pandemic canceled the 2020 Bridge Run, Aleene ran a virtual bridge run and continues her love for running and is now back to her active life.